And hello, welcome again officially, Professor Jennifer Harrison-Hauer, Fortis College, week 5, April quarter. Let's just delve right into things. So you guys, for this week, as you already know, because you have your syllabus available, that you have your discussion question 2. So you should have already posted your discussion post by Wednesday. And then your 2 responses, peer responses are due by Sunday. You want to go ahead and just make sure you guys always, like I've stated in before, that you just follow the rubric. Your responses should add meaning to the discussion, and make sure you guys, so you can get your full points because points matter. Make sure you guys are citing your responses as well if they need to be cited. And then you have your in-class questions. I'm starting to get a good bit of them. Some folks still, you have a little bit of time, it's fine. And then you want to, of course, prepare for exam 3. I will have my review at 9 p.m. your time, 6 p.m. my time, if you're able to make it. As the reviews become available to me from other professors, I think I posted a couple already that have taken place. We're the last class of the week, so I will post my review after we're done tonight. And then I believe there's one more review. I know I think there's a review Saturday with Dr. Lundy. I'm not sure of the time, so of course, check your announcements. As we've stated before, you really want to try to come to 1 or more reviews if it fits in. Okay, so enough with that. But next week is our exam in class. And like stated before, that is your class, whether you complete it. And I've known folks to complete it in 30 minutes and make the highest grade in the class. I've known folks to take the entire class and make the highest grade in the class. It's not a race. And so, yes, so then if we have time, I may touch on some things, but I really do, it's not a review. You really want to try to come to the actual review if you can. Live is better. You can bring, it's just better. Okay, so this week we have our chapter 8, environmental health, chapter 10, epi, and chapter 32, which is our occupational health nurse. I'm going to start with the order I'm going to go in. I'm going to start with the occupational health nurse, talk a little bit about that, and then our chapter 8, environmental, and then epi is kind of a big piece. It can be intimidating, as with all the chapters. I mean, and you notice that, like, for the next, I don't know, the chapters seem to be just 2 or 3 or what have you. They're more focused really like on population health, public health, community health. That's what I love about it. It like starts to get into the meat and taters of things and really kind of delve into what this class really is all about. And epi is a huge piece. So as with all the chapters, of course, you want to read the chapters. You want to do a good reading of the chapters at least once, not skim it. You want to actually read it. And then, I mean, but well, before you start, look at the look really look into your concepts. Like, okay, this is what you should have a good understanding before you move on with that chapter. Let me go ahead and share my screen. We're going to go through some concepts, questions right off the bat. No, all right. I don't want new slides. Oh, I did a new slide thing. I don't want that. All right. So we're going to review some things, you guys, that I really think will just kind of help hone in what we're trying to make sure that you understand. So let me get my preventer view out. You guys moving your faces so I can see the screen. Bodala, environmental health. What comes to mind when I say environmental health? What comes to mind?
I think it's our surrounding, how our surroundings influence the way how we take care of ourselves.
That's good. That's good. Excellent. Excellent. And then, okay, so Ms. McDowell, I need to see your face. This is being recorded. And then Ms. Myers, environmental health, what comes to mind?
Like air pollution, chemical pollution.
So when you think of environmental health and as it relates to public health and population health and all of that, we know about the air pollution. That's definitely a hot topic. Climate, chemicals, you hear about different things, but what you want to keep in mind when you think of and these are actually, I'm pulling concepts from the chapters that I really want to kind of dive in deeper and like make sure that you guys get it for important reasons, is that your environment, first of all, it's outside, but it's inside as well. So your homes, your schools, your playgrounds, your workplaces, the noise levels, the this, the that, the air pollution, diseases, lack of access to healthcare. So you're looking at factors around your home and your being that can positively or negatively impact your health. So for me, individual wellness, public health, everything that goes in and around you. So for example, my environment, just think about when I study, has to be sub-zero quiet. I have no music, no anything going on. I think it's probably has the fact to do with that, like as an introvert, believe it or not, like I process internally. So like if I have external noises and stuff, it can impact if my environment is not set up the way that I can study, it's going to impact my learning and what have you. So it's not just a matter of individual wellness, it's just the conditions in and around you that can positively or negatively impact your health for the better or for the worse. So again, chemicals, air pollution, climate change, diseases, lack of access to healthcare, poor water quality, and global things that filter down to everyone on this earth that we live in. So that's what you want to think of when you consider environmental influences. So when I look at this particular concept, I think, okay, so now I have an understanding. And if you want to, like in your mind's eye, like keep an example in your brain, like, okay, air pollution. All right, so if you already know, if you're in an area where I don't want to pick on like San Francisco, what have you, where, smog and what have you, what can you do, if anything, as a public health nurse? Because there's always something you can do, and you're not, again, you're never out there by yourself alone and what have you. So if you have someone that has COPD or what have you, and let's say there's a smoker in the home, you can work at it from that angle. You can help with filters for the air conditioning. You can see about programs for, because they're expensive. We have them in the house because I have a daughter with respiratory stuff, air filters, purifiers, that sort of thing. Try to control as much as their internal environment. Work with that individual to stop smoking, smoke outside, change their clothes, shower before they come around that person. Little things that you can do so that They already have COPD, which is, you know, the disease. So you're doing tertiary stuff for that individual. But just keep that in mind as far as that particular concept is. You would want to have an understanding of that as well. Miss Manisha, skills that is needed by nurses practicing in environmental health. So I just kind of went into what environmental health in the public health realm looks like. I know this looks like a loaded question, but these questions are coming directly from your chapter, various questions. So now you're this public health nurse, all right, working out in the community, and you're focusing on environmental health for this particular day or week or what have you. What are some skills you think you need? I'm going to ask several people. Just give me one thing, Manisha, that comes to mind.
Maybe like checking the environmental databases.
Yes, yes, yes. I'll take that. I will definitely take that with joy. And then Miss Murray. Your environmental.
Sorry, I was on mute. They need to promote health and safety of the workers that they're working with in the environment.
I'll take that. That's a little bit more of occupation. Well, I'll take that. Yes, you can. Yes, yes. Miss Brumbaugh. Hat turned back.
I think with environmental stuff, you need to almost pay attention to the cultural stuff that's going on with your patients. So they may have cultural practices that you don't necessarily do, but it will involve their environment.
You want to give me an example?
Well, so I don't know. So like for us, we're automatically going to, after we cook our dinner, we're going to put it in the refrigerator to make sure that,
Right
bacteria
away?
and stuff
You're
doesn't
not gonna let
grow.
it cool down first, no?
Well, I mean, let it cool down a little bit, but then you're going to put it in the fridge. For a lot of cultures, they just leave stuff out.
Uh-huh. Okay. I'll take that for sure. And let me get Miss Letitia. You want to add to this?
Yeah, I wouldn't say so much of it as a skill, but you need to know your resources that are available to you.
Resources are always good, definitely so. Let me tell you what your chapter says. So this is one of your concepts. Describe the skills needed by nurses practicing in environmental health and apply the nursing process to the practice of environmental health. So what your chapter says is that you're going to be working in community involvement and public participation. So you're going to be organizing. So you need, so when you think of skills, you want to think of things that are needed for that individual, talents, if you will. So you have to be really good at organizing, facilitating, moderating different events. So that's like a good skill to have to begin with. But if you're working out in, if you're focusing on it, well, any of it, honestly, but if you're focusing on environmental health, you need to organize your data, you need to facilitate it, you need to distribute it, you got to know how to flow in large groups when you're working with folks, as far as if you're doing presentations or what have you. You want to have skills in organizing your community and getting them to help, so you have to have that ability to have that voice that people want to do what you say. So then you're looking at organizing, facilitating, moderating. This is all coming from your chapter. Community organization, mobilizing folks for action, have a meaningful voice is what it says in decisions that affect your community. So oftentimes what's wonderful about public health nursing, when I work public health nursing, is that we have this assumed authority. You know, like you're coming from the health department, I'm from public health. And so that automatically, for good or not, gives you this perceived authority, like, oh, she knows what she's talking about. You need assessment skills. And so that's nursing. But then again, we're talking about environmental health. So you have to feel comfortable with your assessment skills and in assessing an environment that you're in. And so you can do different, they talked about risk assessments in the home. You want to detect potential and actual exposures, pathways, and what have you, so that if there's disease in the home or suspected, you want to be like have an idea of how to go about actually doing an actual like risk assessment of where potentially that source came from. And I know that's a lot, but again, you're looking at it from the environmental piece. So we're just taking big chunks out of all of this as far as public health is concerned. But when you're in the home, again, what Megan brought was Ms. Brumbaugh brought out was excellent as well. I'm just going to take it and spin her comment, because you can take it from the fact that cultural practice, if for some reason someone developed left food out, I'll take it and run with it. And that was something they always did, part of their culture, whatever culture, I don't know. And so they tended to have a high incidence of, that's that word again, of GI illnesses. And no one can figure out why at the doctor's office, but they send out Ms. Brumbaugh, the public health nurse, and she does her assessment, and she does it well. And she figures it out that this, I'm just running out my mouth. She figures out that this particular ethnic culture believes in leaving food out for the gods. I don't know. So then you would do your risk assessment, your investigations, and you would work with them on proper storage of food within their cultural practices. Not sure how that would look, but you want to bring up the fact that, you know, different germs and microbes, certain temperatures, and I don't want to go too far down the yellow brick road, but that's an example, because you want to be respectful of their culture, but you don't want them to keep coming in the doctor's office with the runs either. All right, excellent. And so I'm just going off your chapters here, and then so you want to be able to detect potential. So then you always want to be proactive when you're doing environmental health and actual exposure. So that foodborne illness would be an example as well. And then risk communication, being able to interpret information that you receive. Whether you're doing it from looking at different databases or you're gathering information yourself, you have to know how to understand it and apply it. Then that probably goes a little bit more into our EPI chapter. We are considered, like, again, the experts at issues that affect the public, whether it's an environmental standpoint or what have you. And again, this will go into our EPI chapter, but in EPI investigations, you need the skills to be able to respond scientifically and use those words that they talked about in the chapters, and rates and mortalities and morbidities and incidences. So you sound like you know what you're talking about. And so you need those skills as well. And what else? Knowing how to look at different rates, birth rates, death rates, what do they mean? Again, this is all this one loaded question. And then at the end of the day, I have written 1 or 2 policies, you know, after the fact, of course, to help reduce potential complications, working out in communities. Again, policies will develop, like we will monitor this, we will inform this, we will do this, that, and the other in conjunction with the community. So then you have to feel comfortable with writing policies, proposing certain things, monitoring, what have you. That's a loaded question, but that is your question. And page 152 is in my notes I have here in case you're interested in where some of this came from, but you would know because you've done your readings. All right. Now, occupational health. So occupational health, you're working with, think of your public health nurse in a defined AT&T, working in, I don't know, any industry, Nike, IBM. We have an occupational health nurse for the Indian Health Service that works on a reservation. And so that particular public health nurse, just like this, the population public health nurses at the schools, her title is, she's still the specialized nursing, but her title has changed to occupational health because she's working with health and safety of workers, and her defined population that she's trying to keep healthy are her workers. So then they have, as anything else, just like school health nurses follow different statutes and what have you, they have standards that they have to follow as well. They promote, do screenings, do continuing education. What else do? They give us our flu shots every year. They respond to injuries, so as well, they're proactive as well. I remember during COVID, they're the ones that we would call in addition to our supervisor, as far as any potential exposures and what have you. And there is a short little clip that I have. I'm going to stop here for just a moment. Oh, you guys, I did not mention before we started, I am going to make time for this case study. So if you don't have it already, you should have had your outbreak investigation case study that you went through. So pull that out at some point. I do have a copy of it, but we're going to be working together in groups. So hopefully everyone in their group has a copy of the case study. It was part of your announcements for week 5. But let me stop sharing. Let me see if I can do a new share. Let me see. Let's try something. Can you guys see the YouTube? Okay.
Occupational health nursing is a specialty practice of registered nurses that provides for and delivers health and safety programs and services to workers, worker populations, and community groups. Have a report of a person down at the OHN's responsibilities encompass a wide range of practices, including emergency response, utilizing the basic registered nursing scope of practice, and where required, have additional competencies in cardiac life support and trauma management. Hi. Okay, thanks. Hi, I'm one of the registered nurses here on site. Can you tell me what happened? I was working on this pipe and it exploded. Blew me back. Blew you back? Okay, and what sore? My arm. Okay, did you hit your head at all? No loss of time. OHNs have a combined knowledge of health and business that they blend with healthcare expertise to balance the requirements for a safe, healthy, and productive workplace. Girls, nice to see you again. So you're ready to return to work, I hear. That's great. Do you have a medical form that I can take a look at? Oh, great, thanks. No limitations, clear to return to work April 20th, right on. So what's your ID number, Drew? The first thing I'm going to do is I'm going to send a template to your leadership and to inform them that you're returning to work. What I would like you to do is clear through the health center prior to returning to work so they can do an assessment.
Hey, how are you today?
Good, thank you.
Good. My name's Paul. I'm one of the RNs that works here. I'm an occupational health nurse. And we're actually just checking you back into work to see how you're made out from your previous experience. So I'm gonna pull up the computer and see what the doctor has written for you.
Hey Drew, we're gonna do a brain function test. I'm just gonna put this over your nose here. Okay, so deep breath in and blast, keep blowing, and you can stop now. Good job. Okay, Drew, we're gonna complete your hearing test now. Red to right, and you can adjust that.
I work with a lot of occupational health nurses at St. Jude. It's very valuable. The reason occupational health nurses are so important is they have an understanding of the workplace. Preventive approaches, dealing with injuries, returning people back to work, and understanding the workplace. Having a well-trained staff and occupational health nurses at St. Jude really helps people get back to work early, employees get back to work early, and I feel very comfortable with the quality nurses we have at St. Jude.
We really appreciate the value that occupational health nurses bring to us here at St. Jude. They're a key member of our overall safety, health, and environment team. And they're actually one of the few professions that stays with an employee throughout, in some cases, multiple decade careers, right from the initial recruitment screening process through ongoing surveillances, with the end goal being that we want to make sure our employees have a long, healthy, happy retirement.
Another great aspect about having occupational health nurses is the teaching. Teaching is very important because occupational health has a great preventive medicine component to it. The nurses understand the workplace, and they're very good at spending a lot of time teaching and helping people prevent injuries and illness as well.
All right, you guys, some key words: teaching, teaching, prevention. You guys heard that over and over again. That's one of the things that I love about our occupational health nurse as well. She's there with our, let me get you guys back up here. Give me just a second. She's there with our first day of orientation. And like the gentleman mentions, they are, screen sharing, there we go. They follow you throughout your career. Not every place, I mean, first of all, occupational health nurses average 6 figures. But just like any specialty nursing, unless they have some type of intern program, you can't just walk into occupational health nursing, again, unless they have some type of entry level where you can just work your way up. But at the height of your career, any specialized nursing, and again, I'm trying not to digress because we got this case study, any specialized nursing, your salary is always usually in the 6 figures. Let's say an L&D nurse at the height of her career, dialysis, anything where you specialize. I always recommend that you specialize once you figure out what you want to be when you grow up, sort of thing. Anyway, okay. All right. So let me just get back to my PowerPoint. Where was I? Here? Let's see. Let's try it. All right. You guys good with, you can see everything? Yes? Cool. All right. Going on. All right. So we did our occupational health. All right. Now let's get into the EPI component. EPI may look intimidating. I always say, you guys, when you're doing when you're looking at this particular chapter, especially if your mindset is not into like numbers and different things and rates and what have you, again, read it, and then just tackle it piece by piece. Go back to, again, those questions at the beginning, and if you can answer them, or have an understanding, then you're really going a long way. So let me ask Sarah, when you think of epidemiology, what the word, just epidemiology to begin with, just what pops out? I know it's a lot. You got this. I'm gonna ask Ms. Gore and Ms. Alexandra as well. So I can hear from
Sorry,
everyone.
I didn't realize I was on mute. I was talking, but I didn't realize I was on mute.
You're
I
safer
just
then.
said,
Go
I
ahead.
said it's like a study of something dealing with health. I don't know what, because I've never
All
heard
right.
of it.
I like the honesty. I like honesty, Ms. Gore. You want to help her out? She's on her own.
I think that it just like what pops out is it kind of sounds like epidemic. So it really just sounds like that's what you're dealing with, everything that has
There
to
is a
do with an
component
epidemic,
there.
the
Added on to
study of
Sarah.
it, the incidences and things like that.
Yes, it is. Okay, now you're starting
Prevention.
to use words I love. Okay, now let's see if Ms. McDowell can bring it home.
Finding the causes of like diseases in populations.
Yes, I'll take that. So Sarah started it, Ms. Gore added to it, and Ms. Alexandra, is it Alex? What do you prefer?
You could say Alex.
Okay, let me write this down right here so I will know. Okay, so memorize this definition. Take it from me. Just go back in your book and memorize it. So I'm just going to read it to you. So epidemiology has been defined as the study of the occurrences and distribution of health-related events in specific populations, including the study of determinants influencing such states and the application of knowledge to control the health problems. So let's just break it down. If there's any words and anything that you don't understand, you gotta take it that, just like how do you tackle an elephant? You just one bite at a time. I would never bite an elephant on purpose. So distribution, that's the first word that comes up. So when you think of distribution, think of patterns. For me, whenever there's a big old word, I'm like, okay, distribution. I'm like, I try to sound fancy. I think of telling my daughter, okay, I want you to distribute these leaves around this palm tree in a circular fashion. Just want you to distribute them evenly. So distribution, think of patterns of health events in populations. When you think of distribution, think of patterns, think of who, what, where, when, how, why. Okay. Who are we talking about? Who's in this thing that what group? Where is this happening? When is it happening? How is this happening? Why? So that's the distribution part of the pattern. Who, what, where, when, how, why. What is the outcome? Who's affected? Where are they? When do events occur? You know, who's affected? Let's just say, what is the outcome? Is the outcome that disease happens because of this particular reason? Who's affected? What group? Where are they? Are they in a nursing home? When do events occur? Is it always occurring during the spring or what have you? So it's like, Epi is your inspector gadget with your big old, what is that thing called again? I can't even think of it, it's early. With the thing to your eye. What is that called? Nobody gonna help me out?
Magnifying glass.
Thank you. I couldn't think of the word. It escaped me. Thank you, Miss Sarah. The focus the focus on this part of it, when you're looking at determinants, you're looking at descriptive epi. Descriptive, describe. That's in your chapters. Because you want to describe things to people. Just like I'm having a conversation with Sarah, like who, where, when, how, why, who, what, how, who. So that's descriptive, describing epidemiology, because it seeks to describe the occurrence of disease in terms of person, place, time. Person, place, time. So determinants of health events are those factors that exposures, behaviors, patterns. How does it occur? Why are some people affected more than others? They can determinants you can think of as individual, social, environmental, okay? This focuses on an investigation of cause and associations. So again, that's a lot for that particular question. But again, you want to have an understanding of the definition of epidemiology, because that's the whole chapter. Because it starts with describing and then it starts going into like little breaking it down. So when I took epidemiology, epidemiologist, that's the term for someone that works in epidemiology. That could never be me. I'm not a numbers person, but we need them. So they're like at CDC, behind the scenes, looking at incidents and rates and looking at outbreaks and breaking it down so that they can give us the data, if you will, behind the scene guys, if you will. But then as a public health nurse, we're going to see how that, we're going to go into how that looks, because when you're involved in epidemiology as a nurse, okay, you are a true detective. And so you probably think, I got to do this, I got to do the environment, I got to do this, got to do that. It all, it's like shifting gears. It depends on what's going on with that particular population or what have you. I have done, when I first moved to Arizona 15 years ago, there was a syphilis outbreak and CDC was out there. And that's what brought me out. And getting all the nurses, one of the things that happened was that one of the nurses that had been on the res for a long time noticed that she had 2 syphilis cases. And within an X period of time, weeks, a couple of months, I don't know, where there were usually none. So for me, I think of like spider senses. I can imagine, I talked to her about it later. And she's like, let me just go out there and start doing some screenings and whatever. And then they found more and more. So think of, there's an example, I think it listed in your book, okay. And this is page 170. So I always take little notes for myself whenever I read, because I read your chapters too. I do. One of the things I do when I prepare for class, I actually read your chapters. Every semester I go back and I just read them. And I'm a speed reader. I'm gonna be honest with you. I take notes and stuff. So it talks about as true detective work. So your epi piece is that. So for example, it talked about this man who visited a country other than where he lived. So let's just say I'm not gonna pick on any country. Let's say he visited the United States and he's from France. Within 3 days, he mentioned that he was started having nausea and diarrhea. All right, so he had the runs. So then they started the think of the nurse to going out to visit him. So the epidemiology process starts to take place. So you want to think of what, Miss Lynch? Have I asked you a question? I got my notes here. I want everybody to talk to me today. Miss Lynch. No Lynch? I see you. Do we have a dog? What are some of the things that you're going to think of specifically? Guy visiting from France has the runs and he's nauseated. What are some questions you're going to give me? One question that would come to mind if you're coming out to visit him. What would you ask him?
Oh, it wouldn't let me unmute, sorry.
Okay.
What did he last eat?
Okay, stop there. Thank you. Is Katie with us? Katie, what would you ask him?
I would ask him who he's been around. Maybe
Mhm.
he contracted some virus from someone, like a friend that he was visiting.
I'll take that. Do we have, who has not spoken to me today? Miss Nickerson? Did I think I did ask you a question. Has everyone chatted with me? I think I'm missing some people.
No, Ty.
Who? Ty?
Not me. Not me.
Who's me?
Delay.
I'm sorry? Miss
Delay. Megan. Delay. The other
Oh,
Megan.
Megan. Okay.
The other Megan.
The other Megan. No, first I have it like on this short views. So I have to kind of like, it's easier for me to just ask who. Okay. Megan, what else would you ask?
Relatable symptoms for anyone else he's been around. What other places he's visited.
Okay. You just taking the whole question. Believe it or not, when Miss Lynch mentioned eat, nobody said anything about drink. I know it's like eat or drink. I know you're like, but you want to eat. People differentiate that. I know that sounds like nitpicky, but because I know you're like, it all goes in your mouth, but some people just, drink, water, Gatorade, that sort of thing, and what have you. So you want to know about liquids too. What did they eat? What did they drink? Did others eat or drink the same thing? Just think about, like, especially parents here, you or not, or anybody that's taking care of little siblings. We go in, this is a great example because it goes into like, everybody knows what you eat, what you drink. Did anybody else eat, drink? Where'd you go? What'd you eat? Who, where, who, where, why, who, when. Why didn't, Miss Lynch and Miss Gore both went to the same restaurant, had the same meal, but Miss Lynch was the one that became ill. That's part of that. We'll talk about that next thing there that's on my screen. He realizes that the only thing he did differently from the others, or the public health nurse realized, I'll just say that, because we're going to find this, from the others, was that he used water from the bathroom faucet to brush his teeth, and the others did not. Okay, that's just a quick something. It can be, that's the thing, like, you really, like, you would overlook it, maybe not you, people may overlook it or what have you. Public health nurse is simply complex. I mean, it could be the simplest of thing, like he brushed his teeth from the bathroom faucet water. This came from your chapter, didn't come from me. And that's what did it.
If you're coming from a different country, aren't you typically supposed to drink bottled water anyway? Because the water at a different country, you're not used to it and your immune system may get upset easier.
I'm gonna say yes and no. I mean, so I said he came from France to the United States. You're gonna talk about our country like that.
No, but like I
know, I get what you're saying. I get what you're saying. But then I'm gonna say yes and no only because I want to talk about this. Number 2, emphasizing you want to know this, what this means. So I'm going back. Who has not talked to me today? Has everyone talked to me? I'm missing a person. Unless I can't read my own handwriting.
I have not.
Okay, who's I?
Deepa.
Miss Geary.
Yes.
Lena, what? Let me start easily. This is the epi triangle. The environment, the host, and the agent. Give me an example of environment.
Environment would be a specific place. Since we are talking about the disease outbreak, I would say the specific place or country or like city the disease was first seen, I guess.
I'll take that, but I want more. Who has not spoken to me? Has everybody said something? I'm going back to Budala. Environment.
Environment. I think it is, that's where the place of origin, if it was like the virus infection, where it is going to start.
So your environment, again, is internal and external that give it host or agent influences that person, that host. So again, what the environment could be, it could be the air, it could be the pollution, it could be the water. It was the water, remember? That's the environment. Anything that is internal or external to a given host or agent that influences that host or agent. And I know that sounds like a lot, but when you look at the triangle, keep that triangle in your mind, know it. And then let's get into, I want to get with this. Manisha, host. Example. That should be the easiest one.
Hold on. What was the question again?
Host. What's the host?
Like a host.
Are you a host?
Yes.
Okay. Don't hurt yourself. It's good. Miss Murray, I'm looking for one more thing. Human or
Animal.
thank you. So you want to know that. And again, you're looking at this triangle. So host, a living species, not the doorknob, not this table, not this computer, not this iPhone, a living species capable of being infected or infected or affected by an agent. So just again, start small, okay? Host, I'm a host. Okay. And then your agent, Miss Broomba. Just like saying your name, Broomba. I just want to go like that. Broomba.
Yes.
Agent.
If you're an agent, you're like,
So host is a living species. The
Mhm.
environment is like air, water, that sort of thing. So then in this triangle, we're missing that one little thing, which is the host. And a host, I'm sorry, did I say, where am I? Agent.
you said agent.
Agent, yeah.
So the agent is the thing that you need to like activate.
Give me an
What's-
example of an agent. Let me just do it that way. That might be easier.
Okay, so I don't know if you do have like
Is COVID an agent?
a virus in the air.
Yes.
The-
That's all I want. Don't hurt yourself. An animate or inanimate factor that must be present or lacking for disease. So you need a thing. So how I would tackle this is that I would have a basic understanding of this triangle. So the whole point of this epi triangle to begin is, okay, is that first you got to realize that epidemiologists, they know that disease is complex. It's a complex relationship between the agent, the susceptible person, and the environment. So these three simply complex things, if they're not balanced, disease at any point, if any of those, one or many, unfortunately, some people have many of those that are affecting them, disease can occur. So if the host is not susceptible, that's why some people get sick, some people don't. Let's just say the guy with the diarrhea, let's just say, again, some other people brush their teeth. They gave you a real simple example, but then it gets kind of, again, have you ever known people in your family, like this person got sick, got COVID, but the other person never got COVID and all this kind of stuff? I would assume that that individual was susceptible for whatever reason. They could be part of this vulnerable group where they're immunocompromised. Then you get more, the chapter keeps it simple. But then these three things, if any part of that triangle is unbalanced, then disease can occur. But what I like about it is that as a public health nurse, as I remembered, if you keep that, if you keep that host strong, as far as not being, you work on whatever it is their issue is, again, diabetes, getting a flu shot, whatever you can, getting their A1Cs at a level it needs to be. So if you can also positively impact these areas so that the disease does not occur. So that's where you want to think of as a public health nurse. So the agent, the host, and the environment, that's your epi triangle. And you want to understand what that means. Changes in just one of the elements of the triangle can influence the occurrence of disease by increasing or decreasing a person's risk. You want to always try to decrease their risk so that they do not get a disease. But any of these factors, if they're negatively impacted, can increase. So it's not you don't have to think of it as a negative point as well. You can think of it as a positive point to keep that person. So if you had someone that, let's just say, I have friends that never got COVID. So their environment and their host and the agent, none of those were affected for whatever they kept themselves, they kept their triangle balance. So you want to keep your triangle balance where disease does not occur. So then that's in your chapter 10, of course, and how these interact and influence the environment where disease can occur. So again, your agent is an animate or inanimate factor, E. coli, COVID, different bacteria, viruses, that sort of thing. Host, that's the easiest one if you should see that anywhere in your life, human or animal, capable of being infected. Because the thing is, you can have an agent, okay, but if there's no one to infect, it's just like, okay, if you put a droplet of on a table, that's not a human or animal, it's not going to be able to replicate itself and do any damage. And the environment is all that is, that's all that's internal or external to give a host the ability to affect that particular host. All right, you guys. And then, because we need to get into this case study, let me just kind of go into epidemiology and public health nurses. We touched on it a little bit. So nurses, we collect, we report, we analyze, we interpret, we communicate. All of those are things that are needed as far as the epidemiology piece of it. You're looking at data all the time in nursing. But again, if you're out in the community, more so you're looking at statistics, you're looking at health data from the health department. When we are involved in the care of people with communicable disease, we use epi data to identify. You have to report to health departments. When you're treating, you're providing follow-up cases and contacts, TB, gonorrhea, someone was exposed to syphilis. So you're going out, you're doing your investigation with that person. Who have you been in contact with? Who, what, where, when, how. reach out to that contact, offer them screening, offer them whatever is needed. Who have you been in contact? Who, what, where, when, how? Keep on going, keep on going, keep on going. And that's what happens when you have an outbreak. When we had the COVID, it kept going and going and like, who, where, who, where'd you get it from? Who, you work, school, environment, what? So COVID is fresh. So that's an example. If you were ever contacted, my daughter was exposed at school and the nurses called and say, well, and she's been exposed to school. How does she feel? Who, anybody in your house sick? I'm like, no, we're good. We're straight. We're good. We're fine. Thank you for calling. Da, 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 da. But she had to do her piece. I let her talk and what have you. It was like, why didn't you wear a mask? Okay. So school nurses are an example of they function as epidemiologists. You don't have to have that official title if you're doing that type of work. That's just what it's called. When you're collecting data on incidents, new cases, prevalence, existing cases. You're looking at injuries, illnesses, and your population. So then again, knowing all this information, you want to try to stay ahead of the next epidemic is what you're doing, or outbreak. Outbreaks of lice in a preschool. Outbreak is an outbreak. Anytime you exceed the number of cases that you usually have. So let's just say in Pimacana, we've never had Ebola. If we have one case, that's an outbreak. And that might seem extremely simple, but it does not exist in my area. So if dengue fever existed in one case, we have an outbreak. It exceeds what we have, which is 0. All right, you guys. So I am going to stop my share. And so I am going to, if you, I hope you have your case study that I sent you, pull it out. I am going to put you guys into breakout groups for a few to talk amongst each other. It's going to be random. Does anyone not, okay, now then let me do it positively. Raise your hand if you have a copy of your case study that handy that you're supposed to have. Oh, okay. Okay. Oh, okay. Okay. Well, what's going to happen is I will attempt, I'm still working on sharing this within the breakout group, but if it doesn't come through in your group, then that person in your group will be the person that has it. I want you guys to talk amongst yourselves and then I'll bring you back. So breakout rooms, this will be randomly assigned. Let's see. 14 people today. Carry the 1. Okay. I'm just clicking. Talk amongst each other. Go through your case study. We'll bring it back and finish it up. Randomly assigning people. Just clicking my button. A good time with this clicker. Put you all guys all in the same group. Hi, you guys. I'll bring you back in about another 5 minutes. Hi, everyone. I'm going to bring you back in another 5 minutes, and then we'll just wrap it up. Okay, you guys, I'm bringing you back. All righty, let's delve into this case study, everyone. So how this is gonna go as far as the questions, Alex group will take number 1, Budala's group will take question 2, Megan Brumbaugh's group will take 3, and then Sarah's group 4, and we'll continue to round robin. So let's get it, all right, getting everyone started. And so a nurse at a summer camp for absence observed an excessive number of people at the camp seeking help for diarrhea and or vomiting during a week in late June. Normally, 2 or 3 campers per week would report to the health office with these symptoms. However, this astute nurse noticed that 23 campers, which exceeded her threshold, and staff sought help in a 2-day span. They just attacked this nursing office with all these people with their diarrhea and vomiting. The nurse reported the increased incidence, new cases, to the camp manager and the local health department, and the camp was closed. Yay. All right, so Alex group, take number 1. Someone read the question. Everyone's gonna participate. So Alex group, Layla, and Mickey. I can't even read my homework. You know who you're grouping. All right, so someone read the question.
What education should a nurse provide to campers and staff as they go home? We said increase their fluids because they're having diarrhea.
Yes.
Also washing their hands.
Yes.
Trying to stay away from others who aren't affected to prevent that spread. Seeking medical help.
Okay.
You guys want to add anything else?
Treating their symptoms.
Yes. Thank you. The official answer, see your healthcare provider with any GI symptoms. So what happens is that, they close the camp and they're getting ready to launch these people back to their communities. So she's like, okay. See your healthcare provider if you get sick. If you experience any vomiting, diarrhea, drink plenty of fluids. Like Miss Alex says here, because dehydration, consider an oral rehydration solution. But anyway, washing, because if you tell people like drink plenty of fluids, they might go start drinking coffee, and coffee dehydrates you. Because sometimes I know it's like you would think, but you got to tell people, drink some Pedialyte, drink lots of fluids. You want to drink Pedialyte, you want to drink Gatorade, you have to sometimes like break it down to folks, but that's all it says, added in. Considering, because slow down, if you tell them to drink fluids and they're dehydrating and they start drinking coffee and tea, which will further dehydrate them, it's going to make it worse. So sometimes you have to break it down to people. Wash your hands with soap and water after using the restroom. Do not swim when you have diarrhea. You would think people know things, but as being nurses, you're going to realize that you're like, I don't have to tell them that. Yes, you do. You do. You have to tell people things, and you have to tell them again, and you have to tell them again, and you have to keep that beautiful smile on your face and like, wash your hands when you come out the bathroom. Go to the airport sometimes when you're using the bathroom waiting for flights and see how many people don't wash their hands when they come out. All right. Do not swallow pool or lake water, because it's going to have that bacteria in it that we're trying to stay away from. Okay. Wash thoroughly with soap. Okay. And wash thoroughly with soap and water before you're swimming. So all of that. Okay. Excellent. Moving on to Budala's group. Somebody read number 2. And somebody give me the answers. It's going to get a little bit more challenging, but that's why we're in class. Because I have the answers and I know the answers. Okay. Budala. Doesn't have to be Budala. We've got Budala, Katie, Megan.
I'll read it because I have it in front of me. So, is the infectious disease a communicable disease? Explain your answer following the graph. So we said obviously the host was the people, and we assumed the agent was bacteria based, and the environment was the campsite and the lack of the hygiene within the campsite.
So I need an answer to my question. Very good. So the thing is this disease, infectious disease, a communicable disease? I want a yes or no. First.
Yes.
That's how you get tripped up on a question. You got to answer the question. So the first word in this answer sheet says yes. So you want to answer the question. Yes, it is. And then you want to know, so I was asking you, is it an infectious disease? And I think we have some type of like homework that we're doing. So the answer is yes. And then it wants to know, and I'm a why person. So I'm like, why? So all of those are correct. So the official answer is yes. For an infectious disease to be commutable, which means it can go to other people, or contagious. That's another word if you want to substitute words. That's another thing too. Synonyms. You can substitute words that are like, I don't like saying communicable. I like saying contagious. There must be a portal or exit from the infected person or animal. So let's get out. So think airborne, think, that sort of thing. It has to be able to get inside that person. So then that's why they were like, don't swallow water, that sort of, and the guy with the toothbrush, think of that. So it has to get inside the person, the host. So that's the host part of it. And all these are factors. And then it has to be a way for it to be transmitted. And that's your well water that we'll find out later that that's where things came from, the contaminated water. So, but therefore it has to get inside it has to be a host, which is your animal or person. There has to be the environment, which was the water, not the pool water, it's the well water. And then it has to be the agent, and there is an agent. Very good, you guys. Moving on to.
I have a question.
Yeah, I have an answer.
Part of the environment, you said was the water, but it also touched basis on the septic tank being overflowed because of so many people. Is that also a part of the environment?
It's the water. So even though it's water system, does that make sense? The well water?
Yeah, I was just asking if the septic system was a part of the environment with
not the septic
water.
system itself, as part of the triangle is concerned.
So the septic being the reason the water was contaminaminated has nothing to do with like the triangle part. It's just the water.
It does, but it's not it's the mechanism, but it's not part of the triangle. And then that's where, so if an answer on the answer key was the septic system or the well water, which one?
Which is the water, the well water.
That's how you get like these series of questions and you get tripped up because they're like, and we're gonna get, no, I agree with you, but it's not a septic system is not the environment. They should have fixed it, but we'll talk about it. Yeah, but I don't know, where are my LPNs at? Raise your hand. Do I have any LPNs in here? Tasia, is that your hand? No? I thought there were some LPNs in here. No?
Alex,
yes. Alex. And Megan, right?
No, I'm not.
But Alex, you are, correct? Okay. So Alex, do you know the KISS? The KISS acronym that we like to use in nursing, KISS? Keep it simple.
No.
Y'all never used that? Maybe it's something we did back home. Keep it simple. Okay. And the other S, you could say sweetie or something else.
Absolutely have used KISS in my career.
Thank you. So have you heard of it before, Ms. Brumbaugh? Okay.
Yes.
So the other Megan, keep your life real simple. As far as no, because you'll get tripped up because this exam is coming. And I promise you, I don't know, I like to promise people, just keep your mind like, okay, the water, because that's the environment, the water, the air, the dirt, not the septic system. Okay, all right, where was I? I digressed. Am I with Miss, so we've done number 2. Well, number 3, which will be Brumbaugh's group.
Yeah, I got it.
Okay.
So, are all the campers and staff at the camp susceptible hosts? Explain your answer. So, what I said was, so according to the CDC, a host refers to the human who can get the disease.
Mhm.
So because of this, all the campers and staff are susceptible hosts because they had the possibility of ingesting the agent.
And look, you're giving me big old answers. Thank you. The official answer is yes. In general, there are several host factors. And so these factors are things I like to think of when you do learn what the factors are for your particular population, let's just say. You can work to reduce those risks and factors. Just so let me just throw that out without just keep it there in your brain. So this says, yes, in general, there are several factors that determine whether a person is at risk for being a host. Okay, that's why some people get sick and some people don't. And they are your age, think of your elders, think of your babies, okay? Your gender, male versus female, your occupation, your immune status. Like I said, I have lupus in the household, so we try to keep things away from her. Diet, lack thereof, think of. Chronic disease, those folks with, that we had on the top list to get their COVID vaccines. Remember, they had those categories and stuff. So think of that. Some things you can work with, you can't work with the age, but you can work on other things like the diet, exercise, in educating on those factors. Hygiene, good or not so good. You can work with people on that. Genetic risk factors, can't do anything about that. And I don't want to get into modifiable, non-modifiable, blah, blah, blah. So you work with things you can work with. Especially when you become aware, like, okay, someone's anemic. What do we get them on WIC so they can get healthier foods and that sort of thing. And it also mentioned previous exposure as well. But again, to that particular agent appears to make you more susceptible, but we won't digress into that. All right, 4 would be the group of 1, 2, 3, 4, 5 people. Murray, Letitia, Manisha, you know who you are. And so one person can read it and someone can, don't put it on one person. You got a group of 5. So, and you happen to have one of the most challenging ones. So I like that.
I'll start with the definition of incidence rate. So it says,
Can you read the question, please?
Oh, that's what I was gonna do, but I was just telling my group. What is the definition of incident rate? So incident rate is basically, it describes how fast or how rapid a disease occurs in a particular population. In this case, it would be the camp. And then if someone else wants to do the second part, how it would
help her out.
It's the new cases divided by the population times the time frame to calculate it.
So I just need 2 numbers. Okay, so who just said that right there? Sorry, I wasn't looking.
Tiaja.
Okay, now Sarah, just listen to me. I just want you to give me one thing. What number goes on top? That's all I want you to tell me right now. What goes on top? What's the top number? What's the numerator?
What, your cases?
So okay,